Hello and welcome to New Look, New Life Cosmetic Surgical Arts. I'm Dr. Karlinsky. I'm a cosmetic surgeon, and I want to quickly talk to you about the PRP treatments for hair loss. It has been used for quite a few decades now for many other things like joint issues, wound issues, and more and more we use it for hair loss. It does seem to help quite nicely in combination with other treatments. And the way PRP works is we actually draw the patient's blood, we spin it down in a special system which allows us to extract the platelets with the plasma, which is essentially the fluid part of the blood, and we then re-inject it directly into the scalp where hair loss is visible. The injections themselves take only a minute or so to do, but the process of spinning the blood may take anywhere between 10 to 20 minutes, depending on the volume that we extract. To make the procedure more comfortable for the patients, we typically use something like this, Pain Ease. Even though we utilize very, very tiny needles, this takes a little bit of the edge off and patients almost never even feel the injections themselves. What the platelets then do is they break as we inject them, and they release tremendous amount of growth factors which help to increase blood supply to the hair follicle and make the hair follicle stronger and thicker. It requires several treatments to see the difference. We typically ask our patients to also take biotin supplements. A lot of our patients take finasteride as another adjunct. And we usually do it anywhere between once a month to once every 2 weeks, at least 4 to 6 treatments. And then our patients get on a maintenance where they come in and maybe every couple of months get a treatment in order to upkeep. I'm proud of you. She did good. If you do think that you may benefit from PRP, I welcome you to call our office for a free consultation, or you can visit our website at New Look, New Life Cosmetic Surgical Arts. If you like this video, please give us a thumbs up, and I will see you with another topic shortly. Thank you. Just cut the loop in here.